Hi, I'm Gene McClory. I'm with the Caregiver Assistance Network, a program of Catholic Charities of Southwestern Ohio. Over the years, through the Caregiver Assistance Network, we've been attempting to provide a variety of services to family caregivers. And today, we are very privileged to have with us two nurse educators from Caregiver Educators from the Council on Aging. And they are Nina Wichard and Margie Burlage. Thank you so much for being with us. Both of our caregiver educators have worked for quite a long time with caregivers in showing them the do's and the don'ts of caring for family members. And today, Nina is going to demonstrate a bed bath. And we are very happy to be able to do this here for you, and we ask you to stay with us for this and then for other segments that will follow in other podcasts. Margie or Nina?
Okay, I'm going to demonstrate for you how to do a bed bath. You would want to do a bed bath with someone who may be in a very weakened condition, may be very ill. They are unable to get out of bed, to get into a shower, or even not strong enough to sit by the sink in the bathroom to do a sponge bath. So they can get a very good, thorough bath in the bed, which we just call a bed bath. So today I'm going to use our mannequin, Molly. She's going to be receiving a bed bath. Now, when you're going to do a bed bath, you need to be very organized, so that you have everything prepared and right at your reach as you're doing the bath. You're going to need quite a few things. You're going to have two basins that you can use for water. One is going to be for your soapy water, one for rinse water. You're going to need at least 2 washcloths, 2 or 3 bath towels, your soap. It could either be a bar soap or you can use liquid soap. If you use a bar of soap, you don't want to keep that bar resting in the water because it will get very soft and mushy. So you want to let that bar of soap just sit out either on a towel or on a soap dish. And a word about the bed itself. If you have a hospital bed, you can at this time raise the height of the entire bed so that it's comfortable for you as you're giving the bed bath. That would help to save your back a little bit so you're not straining yourself. You could raise the entire bed up about to your waist level so that it's comfortable. Now today here we do not have a hospital bed, so I'm going to just do it the way the bed is here, but I'm going to be paying attention to my own body mechanics, which means I'm going to be careful how I'm standing. I'm going to have my feet about 12 inches apart so that I have a good base of support. And then as I'm moving about and doing the bed bath, I'm going to try to keep my knees bent just slightly throughout the whole process. And that helps me to avoid straining my lower back, and it'll put more of the pressure on my leg muscles. So I'll have to pay attention to that as well. You want to do the procedure fairly quickly so that you don't want Molly to get cold in the process, and we also don't want the water to get cold. Now, since I could come into contact with body fluids during this process, I would recommend wearing gloves. So I would wash my hands first, and then I'm going to put on these gloves. You always tell your loved one what you're going to do. So Molly, I'm going to give you a bed bath now. Okay, we're ready to go. The basic concept for the bed bath is to work from head to toe. This is also an infection control measure. Okay. So what I'm going to do, I'm going to have 1 washcloth in my soapy water, 1 washcloth in the clean water. I'm going to start with her face. At this point, I might ask Molly if she is able to wash her own face, because it's good to allow the person to do what they can for themselves. But in this case, Molly's not going to be able to wash her face, so I will do it for her. So, first I'm going to start with her eyes. So I'm just going to have water with no soap. I'm going to start with her eye, washing 1 stroke from the inner eye to the outer eye, down like that. Then I'm going to move the cloth to a fresh part of the cloth, go to the other eye, from the inner part to the outer part, washing that eye. And then I will put it back in the water, rinse it out a little bit. You can make a mitt with your washcloth if you would like to do that. You just wrap it around your hand like this, tuck it in, and that makes a nice little wash mitt. And I'm going to use my soap, get it the water, use some soap. I'm going to wash her face. Do her forehead, her cheeks, the nose area, around her mouth. I'm going to get both ears, the outer ear, and then behind their ear on both sides, down her chin area. So you just drop that cloth back in the soapy water. I'm going to take my rinse cloth and then just rinse her the same way. Okay. I'll have my bath towel. Now, throughout the entire bath, we're going to be patting her dry. We're not going to rub because the skin might be very thin and very susceptible to tearing and so forth. So we're going to always pat dry instead of rubbing. Okay. Now, the next part of her body that I'm going to do are her arms. Throughout the entire bath, you only want to expose the part of the body that you are washing at that moment and try to keep the rest of the body covered. Now I'm going to go ahead and take, she's got a gown on. I'm going to take the gown off at this point, cover her up. Just pull it down. And I'm just going to expose her arm. What I'm going to do is I'm going to take the bath towel and I'm going to lay it down lengthwise underneath her arm. Okay. And I'll get the washcloth, get it ready, some soap. Okay, I'm going to actually lift her arm and I'm going to support it with my arm. I'm going to start with her lower arm, then go to her upper arm, her shoulder. Come back down to the hand at that point. Wash your hands thoroughly. And then the last part I'm going to do is the armpit. Okay, drop that back in there. I'm going to get my rinse cloth, and I will rinse in the same way. Lower arm, upper arm, and shoulder, back down to the hands, and then the armpit. And then I'll just use this towel, bring it up, and I'm going to pat her dry. Now I will mention at this point, as you're doing a bed bath, there are two things you want to keep in mind. When you're washing the arms and the legs, this is a good opportunity to do a little bit of what we call range of motion exercises. So you can gently move her arm at all the joints. And that just gives the muscles a little exercise and the joints. And another thing that you're going to be doing is always looking at the skin. This is a perfect time to observe for any issues. You're going to look for any rashes, any bruises, any open areas, any reddened areas where maybe a pressure sore may be developing. So you want to watch for things like that. Okay. Now I would go ahead and just do the other arm in the same manner. The next thing I'm going to do is going to be her neck, her chest, and her abdomen. Now, there are a couple of different ways you can proceed with this. If privacy is a real issue at this point, you may just take your washcloth and prepare it with soap. You may hold the bath sheet. We're calling this a bath sheet that we're keeping her covered up with. You might just go down and sort of work under the sheet. That's one way that you can do it. But if you're really wanting to be observing the skin, I think it's important that you're going to be able to get a good look as well. So what I'm going to do is I'm going to wash her neck area, and then I'm going to pull the sheet down. Now, Molly is a female, so what we especially want to be careful with is making sure that you're going to wash thoroughly underneath her breasts, because that is a place where infections can start if it gets moist and it's not cleaned thoroughly. So I'm going to be sure, I'm going to wash her chest, I'm going to lift each breast and wash gently underneath with the soapy washcloth. I'll turn it over, I'm going to go ahead and do her abdomen. Cover her up with the towel. Then I'm going to rinse the same way. And I will rinse her neck, her chest. Be very careful to rinse gently underneath each breast. Also, if she's a large person and she has some abdominal folds, you want to be careful that you wash in thoroughly in all of the folds as well. Okay, then I'm going to pat her dry and be very careful to be sure that you're getting all the moisture out from under her breasts. Okay, cover her up. At this point, you're going to want to change the water and get some clean water. So you're going to go and get 2 fresh basins of water. Okay, now we're going to work on her legs. Go ahead and get the rest of her gown out from under her. This is her dirty gown, so I'm going to just drop it here in a laundry basket. Okay. Now with her leg, I'm going to do the same as I did with her arm. I'm going to lay the towel the length of the leg. You're protecting the sheets so you don't get them wet. Okay. Got my clean water here, soap on it. What I'm going to do is I'm going to bend her knee a little bit like this. I'm going to wash her lower leg, front and back, her upper leg, her thighs, like this. And then I'm going to rinse with the rinse water. Get another towel here. Whoops. Okay. And I'm going to pat her dry. Now, and one option that you can have, if she's able to bend her knees pretty well, at this point I can actually take the entire basin of the soapy water and I can put her foot down in it. Then I can let her foot soak a little bit. Then I will also clean between her toes and her heel and all of this in the basin. Okay, then I will lift her out. Then I can get the washcloth, rinse the foot off. Now you want to be sure, again, between the toes, you're washing thoroughly between the toes, and then as you're drying, you also want to be sure that you're drying thoroughly between each toe. Do that with this towel. Just get down between each one. Now you also might want to be putting lotion on at this time. So I've got my lotion here. I get the lotion out. You want to warm the lotion up between your hands so that it's not real cold. And if she's got dry skin, I'm going to put some lotion down here. Lotion on the foot, heels a lot of times need it. I don't want to get lotion between her toes. I don't want them to stay damp. Okay, and then I would proceed with the other leg. And once you've done both of the legs, this is another time where you may want to change the water and have fresh water again. At this point, I'm going to work on her back. Now at this point I need to turn her. What I'm going to do is I'm going to turn Molly towards me. Towel here. I have what we call a draw sheet underneath her. This is, whoops, it's tucked in. Okay, I'm going to pull the draw sheet out. A draw sheet is something that you have folded, and it's only about this wide, and I can use that to help pull her body towards me. Okay, so Molly, I'm going to turn you towards me. I want to turn her towards me instead of the other direction because this way I can control her body better to protect her. Okay. Okay, again, I'm going to put the towel down along her back. Try to keep her covered up as best I can. Okay, I'm going to take my washcloth, get it soapy. I'm going to wash the back of her neck and on down through her back. I'm going to do the same with the rinse. Rinse water. Rinse real good. This is a really good time to observe the skin to see if there are any reddened areas or any open areas that are going to need attention. So again, I'm going to pat her dry. This might be a good time again to put a little lotion on, put some lotion on your hands and give her sort of like a little back rub. Rubbing around the shoulder blades. Okay. Now I'm going to do her buttocks. Get my soap on the washcloth. Just the buttocks. I'm not going to do the anal area just yet. Just the buttocks. Okay. Rinse it. Again, watching for any signs of redness, that you might have a pressure area that you're going to have to tend to. I'm going to pat dry. And at this point, I'm going to turn Molly back. Back on her back again. Okay, at this point, I'm going to do the perineal area or her genital area. So, if this is another time when I'm going to ask Molly if she feels like she can do this herself. Sometimes that's something the person may want to do on their own. So I would prepare the washcloth and hand it to her. But again, this time, I don't think Molly can help, so I'm going to do it myself. what I'm going to do is I'm going to raise up her, bend her knees, keep her on her back. I'm going to take the one of the towels, put it under her, tuck it under her buttocks. Okay, try to cover up what's doesn't need to be exposed right now. Okay, get her legs up. I'm going to take the washcloth, put soap on it. Okay, now with the female, you want to wash with your motion being from front towards the back. You could say from up to down. And I'm going to spread her vulva, and I'm going to take the nice soapy washcloth, and I'm going to go from top to bottom, one really sturdy swipe down. Then I'm going to turn the washcloth over, and I'm going to do the same thing on the other side, one swipe down. Then I can also do another one with a fresh part of the cloth down the center. Okay, drop that in here. Get my rinse cloth and proceed the same way, always going front to back, front to back. That is for an infection control measure that helps to prevent urinary tract infections, so you're not bringing bacteria up from the rectal area. You're always washing down towards the rectal area. Okay, now if this were a male patient, at this time you would also wash thoroughly. Then you would also wash the penis, and you're going to do that with strokes. If the male is uncircumcised, you would need to pull the foreskin down and wash that area as well. And then you would wash and rinse and then pat that dry. Okay, the only part left now is the rectal area. That's the last part. We're going to turn Molly one more time. Okay, Molly, I'll turn you towards me. Again, have the towel right there underneath. Okay, now with the rectal area or the anal area, we're going to be washing in the same manner. We're going to go from the front, from the vaginal area, back towards the anus, again for that infection control. So you're going to swipe it again. This time you're going to keep swiping it until you're sure that it's totally clean. Then we're going to rinse and pat dry. Okay, and I'm going to lay her back. Hopefully she has not gotten chilled. So she's very clean. I have observed her skin so I can watch for any signs of breakdown or rash that need to be tended to. And I'm going to put on her clean clothes and get her ready for her day. And that is the way you do a bed bath.
Nina, thank you very, very much for a very practical and detailed demonstration of a bed bath. I know it was a helpful bit of information for me and maybe useful down the line, and I also hope it's good for every one of you who's watching. As I mentioned in the introduction, this is just one of 4 segments on home care for you who are caregivers who are caring for a family member. And as I mentioned, we're fortunate to have Nina Richard, who is a caregiver educator, and Margie Burledge, who is also a caregiver educator, both of them with the Council on Aging of Southwestern Ohio. Thanks so much for your assistance. We also want to remind you that we are the Caregiver Assistance Network, and we offer quite a variety of programs, support groups, talks, as well as a caregiver care line for family caregivers. And if you want any more information, call the Caregiver Care Line at 513-929-4483. We are happy to provide information on resources, including the great resources of the Council on Aging of Southwestern Ohio. And please remember that these podcasts are archived, so you can get back to them. If you want to review what you saw now on bed bath or any of the other segments of our podcasts, they're there for your viewing. We also want to remind you that these podcasts would not be possible through the Caregiver Assistance Network of Catholic Charities were it not for the wonderful, generous sponsors who offer their help to make these podcasts possible. please look at your screen. You will see the sponsors listed. You can click onto each one of them and get lots of information that can be very useful to you as a caregiver. We also want to remind you to take care yourselves as family caregivers so that you are there to provide assistance for those who depend on you for their care. Remember, caring matters.